I'm Madison Tucker, and today I'm going to be explaining why psychedelics assist psychotherapy so greatly. What would you think if I told you that psychedelics are the #1 way to healing treatment-resistant disorders such as stress disorders, depression disorders, and PTSD? PTSD is a very common disorder with people who have experienced great traumas, and it affects them greatly throughout their life. A lot of PTSD victims have even committed suicide, and they have experienced lots of pharmaceuticals to help deal with this disorder, but nothing works. So I want to explain how these drugs were synthesized or found, how they revolutionized medicine, and how they're actually working with patients today. So, as we know, mushrooms have been, magic mushrooms have been used for thousands of years ritually, but LSD is more of a synthesized drug that was created by Albert Hofmann in 1938. The story of him synthesizing this drug is actually pretty funny. He was working with this drug, specifically LSD, a very isolated version of it, and somehow he ingested this, whether it was through his eyes, through smelling, through his mouth, and he went home feeling kind of strange and feeling like he was in a dreamlike state. And so he called his boss saying, wow, I feel really strange, I can't come to work. And he found a sort of enlightenment through this process, through experiencing this drug and the trip that came along with it. And it really opened the door to new ways of healing trauma and learning about the brain, because the brain is the most important and complex thing in the universe. So, with this new research opening the door, we have found a positive shift in medicine as far as psychiatry and the treatment of these treatment-resistant disorders. On July 5th in 2018, Eduardo Skenberg published an article for Frontiers in Pharmacology about the mental health crisis that we are experiencing not only in America but in the world today. And through this pandemic, as we have to sit in our homes and really sit with our thoughts a lot, mental health is on the decline right now. Mental health has been expanding into a larger conversation, which is good, but these things are still very hard to treat. Many patients don't respond hardly at all, if at all, to antidepressants, anti-anxiety, such as Zoloft or Xanax, just to name a couple. So the research of this is really growing, the research of using psychedelic assisted psychotherapy, PAP, and it has actually been a breakthrough for mental health medicine. Patients who have struggled with severe PTSD, suicidal thoughts, and eating disorders such as anorexia and bulimia have actually experienced great relief from this mental disorder and these extremely hard things to deal with internally. So it's just great that we are finding a new pathway to healing the brain, which is, like I said before, the most complicated organ to deal with. Another researcher, Craig Heacock, published an article in December of 2020 stating his research that he has found through his clinical trials using psychedelic active psychotherapy or assisted psychotherapy, PAP, to heal his patients. He had multiple clinical trials for this, and not only did he use psychedelic drugs such as psilocybin and LSD, but he used ketamine and MDMA as well. MDMA is a psychedelic, but I'm more specifically talking about psilocybin. During his research with psilocybin, he found that he could get to these pathways of damaged brain cells and parts of the brain that were traumatized and are causing lots of fear for the patient, lots of fear, anxiety, depression, eating disorders, self-harm disorders, self-harm addiction, even drug addiction, alcoholism. This Psilocybin has been a huge pathway, a huge breakthrough to helping dealing with these disorders, and he states in his research that through these multiple clinical trials and through all of these months of working with these patients using psilocybin and LSD, he found that 63 of his patients didn't even need to seek therapy after he was done with these clinical trials. They didn't even qualify for the clinical trials to move further, and he even says that for years after these psychedelic experience treatments, the patients didn't seek therapy for years, and they have yet to seek therapy. So that is just something that is really awesome, because some of us may know that depression disorders and anxiety disorders are very, very difficult to treat. So with all of these awesome things that we have learned, psychedelics are actually a great pathway to figuring out the brain, learning more about the brain, and healing the brain, which is very awesome. And like Francis Crick once said, there's no scientific study more vital to a man than the study of his own brain. Our entire view of the universe depends on it. So hopefully we can continue these beautiful trials, and we can continue to learn about the human brain. Thank you so much.